الحمد لله نستعينه ونستغفره ونعوذ بالله من شرور أنفسنا ومن سيئات أعمالنا من يهده الله فلا مضل له ومن يضلله فلا هادي له ونشهد أن لا إله إلا الله ونشهد أن سيدنا مولانا محمد عبده ورسوله صلى الله تعالى آله وأصحابه وسلم تسليما كثيرا كثيرا. سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي. Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to our webinar on the medical fiqh of fasting. So inshallah, today we have some special guests who will assist us in answering some of your queries, inshallah, in relation to some of the questions or some of the common questions that we have when it comes to fasting in a Ramadan, and some of the medical interventions and procedures and various other things that we undertake in this blessed month, and whether they would invalidate our fast, what is the ruling behind it, what is the hikmah behind it, what is the wisdom behind it, etc. So you'll have plenty of opportunity, inshallah, today to ask as many questions as you wish. Please use the Q&A for your questions, and if there's any technical questions or queries, please use chat. So inshallah, what we'll do is the agenda today will be such that I'm going to do a presentation just to get you familiar with the terminologies of things that we need to talk about when it comes to discussions regarding what invalidates the fast. So it's important that you understand the background, so that when we actually start going into the detail, then inshallah, hopefully you'll understand the depth of our discussion, inshallah. So what I'm going to do is I'll just put up my presentation. So I'm not going to go through the whole of this presentation, so hopefully you can see this, but I'm just going to talk about some of the things in relation to the issues that we need to know about before we actually go into the deep discussion. And then what I'll do then is I'll introduce our special guest today, and then we will open up to questions. Okay, so let's begin first. And the first thing that we need to really sort of get right here is the fact that the Quran does talk about certain concessions that are to be made for those people who are fasting. The first thing that we need to understand is the Holy Quran says, يَا أَيُّهَا الَّذِينَ آمَنُوا كُتِبَ عَلَيْكُمُ الصِّيَامُ كَمَا كُتِبَ عَلَى الَّذِينَ مِنْ قَبْلِكُمْ لَعَلَّكُمْ تَتَّقُونَ. O believers, fasting is prescribed for you, as it prescribed for those before you, so that you may gain this ability of God consciousness or self-restraint. So fasting clearly is mandatory, it's compulsory on all Muslims who fall within the criteria of those who are qualified to fast. And then also in conjunction with this verse, there is a continuation where Allah subhanahu wa ta'ala says, أَيَّامًا مَعْدُودَاتٍ فَمَنْ كَانَ مِنكُم مَرِيضًا أَوْ عَلَى سَفَرٍ فَعِدَّةٌ مِنْ أَيَّامٍ أُخَرَ وعلى الذين يطيقونها فدية طعام مسكين فمن تطوع خيرا فهو خير له وإن تصوموا خير لكم إن كنتم تعلمون. So it says here, فمن كان منكم مريضا أو على سفر. So if you are ill, sick, or you are on travel, then the فعدة من أيام أخرى, then fast a similar number of days later. In other words, fulfill this through qada, through fast that would make up for the days that you missed. So here this identifies certain concessions in relation to fasting. So clearly we recognize that there are certain instances where you may be sick, and for that reason you would be exempt from fasting. Now the issue that arises here, what are the conditions that are required to be fulfilled to suggest or for you to be considered as a marid, so that you would be exempt from fasting? So we will talk a bit about that as well in more detail. So just to move on, this is a general outline of the kind of people who are sort of obligated to fast and the ones who are given some kind of concession in terms of fasting or exemptions related to fasting. So first of all, I'm just going to go through this briefly, and then inshallah we'll get plenty of opportunity to talk through this in detail. So if you're generally under the age of 12 years, so under the age of puberty, so if you have not achieved bulugh, then in that instance, then it is not mandatory on you to fast, though it is encouraged for you to fast in your early years, prior to achieving maturity, so that your body is accustomed to this sort of ritual during fasting where you are abstaining from food. So it's highly recommended that children do fast a few years even prior to achieving puberty. The other group of people are people who are incapable of fasting due to, number one, physical illness. So if you have a physical illness, then on the basis of that, you would be exempt from fasting. And this would suggest things like, for example, that you're acutely unwell. For example, you may be elderly, you may be frail, you may have an acute illness. And this would also be an exemption for you not to fast. Just one second. Okay, so other conditions would be, for example, terminal disease. So if you have a end-of-life condition, so these patients will be required to offer fidya. We'll talk a bit about those concepts later on. We have Mufti Abdullah Nana and so forth. So we'll talk a bit about fidya, and we'll also talk about issues of kafara and qada as well. So these are things that we need to understand in terms of how this relates to being unwell and fasting. Then there's those individuals who have chronic diseases. So for example, diabetes and bronchitis, COPD. So these patients will be required to offer compensation and fidya if they fulfill the criteria that they are that unwell that it would be difficult for them to fast. Then we also have individuals who have mental illnesses, so or learning impaired, who may have poor insight, poor understanding, what we consider as 𝐁𝐚𝐥𝐚𝐿, being able to differentiate between right and wrong. And those kind of individuals would, in this instance, be considered as exempt from fasting as well. We also have pregnant women or breastfeeding mothers whose health or child's health will suffer from fasting. So by default, they're expected to fast. But however, if their health is deteriorates as a result of fasting, then they are also exempt from fasting. And they can also make up days, qada, on alternate time. Then we also have menstruating women. So these are women on haid. So they are menstruating women or women with postpartum bleeding. So nifas. So these kind of women do not fast because they're not in a richly pure state to fast. And for that reason, they make up the fast at an alternate time. And finally, like the verse stipulates regarding those who are in safar, those who are musafir, they are traveling, they are also considered as being exempt with those conditions in relation to fasting due to hardship. So having said this, we will come back to some of these things in more detail, inshallah, later. Now, just to give you definitions, and then inshallah we'll go into the details of this. But what is qada? So qada is when you make up for a missed fast of Ramadan on another day other than Ramadan for a number of different reasons. So it may be that you've missed the fast because you're unwell, or you missed the fast because you've had menstruation, you've had periods. And for those reasons, then qada would have to be made at another time. So what is fidya? Fidya, atonement. So fidya is when someone cannot fast in Ramadan and cannot make up the lost days afterwards. So those are instances where people who have usually chronic severe ill health or frailty, so they are not able to make up for the fast, even during the winter months where the fasting day is shorter in some parts of the world. So for them, they would have to pay a fidya, and they should then pay to someone else to be fed. And we'll talk about the criteria of fidya, maybe inshallah we might get a chance to talk about that. And then we also have what we call kafara, or expiation. So this is a compensation that is paid if a person deliberately, so the person fasts, then they deliberately break a fast in the month of Ramadan without a valid reason. And we'll go into the details of this later on. But generally speaking, they would either fast for 60 consecutive days or feed the poor 2 meals for 60 days in that sort of combination. So, and then I'm just going to outline something about safe fasting. And this is something we're going to talk a bit about. We got a physician with us today, inshallah, so we'll get a chance to talk about this in more detail because they've done quite a bit of work around this. But a couple of principles that are worthwhile noting about safe fasting, which the fuqaha have stipulated in the books of fiqh, and they relate it in this way. And I sort of put it down as, I call it the 4 principle approach. And the idea is that if these four things are inevitable and they are things that are going to occur if you do fast, then these would be reasons to exempt you from fasting if it reaches a certain threshold. And I'll talk a bit about the threshold in a short while. But generally speaking, if you have a worsening physical condition, so if your condition worsens by you fasting, then that would be a reason for exemption. The other is that if you have slow recovery, so clearly you have a serious condition, acutely unwell, with, let's say, for example, chest infection, and it's then by fasting, that condition is slowly recovering relative to if you were not fasting, and to a certain threshold, then that would be another reason for exemption. The third is worsening mental condition. So if your mental condition is such that you're unwell mentally, and you begin to fast, and clearly your mental condition worsens as a result of that, then that would be another exemption. And then finally, worsening pain. Now, this is an interesting one because we become quite immobile on the basis of pain, and that could be quite detrimental. So if your pain is a lot worse by you fasting because you're not able to take certain medication, for example, or generally speaking, you're more prone to feeling the pain's intensity more so because you're fasting and you're feeling weak, then that would also be an exemption from fasting. Now, even though these four principal approaches suggest that these are the things that you'll be looking out for, the reality is that at what stage do we say that the condition has worsened to that level that now you're exempt, or your condition has worsened to that level, or your recovery is that slow that, and these are the end sort of outcome of this, and hence you are exempt from fasting, or your mental condition has worsened to that degree, or your pain has worsened to that degree. The degree that we measure here is where you are unable to physically, mentally perform normal and important daily chores. So these are sometimes described in the books of fiqh, where it mentions that somebody is unable to walk, for example, or it says that somebody is unable to ride a horse. And these are sort of kind of descriptions that the fuqaha have basically stipulated in context of the typical sort of regular life daily chores. So in essence, if your physical condition has worsened to that degree, or recovery or mental health or pain has come to that degree that you are no longer able to physically or mentally perform your normal important daily chores, then that would be the reason at that stage you could say that you would be exempt from fasting. Okay, and we'll talk a bit about that later on. There is something else about fasting and hardship, and hopefully, inshallah, we'll get the opportunity to talk about this in more detail as well. So, for example, if a person is working hard, and if he is to be harmed by this, if they are fasting, and he is fearful of physical harm, then that individual would be exempt from fasting. So they can actually break their fast. Now, the issue here in all these statements, and I'm not going to go into too much detail, but generally speaking, the point to be made is that if you are somebody who's working and the work requires quite considerable hardship, and the hardship is to the degree that you are likely to be impacted, like we described previously, to the degrees that were mentioned in the four principles, then on the basis of that, you would have a legitimate reason to break your fast for that reason. Now, this works on the idea of what we call tajriba. So experience suggests that this is the situation, and those kind of individuals, or you as a person through your experience, personal experience, that I have fasted and I was in this condition and this is what my end outcome was, then that is sometimes good enough for you to exempt yourself from fasting on that particular day, if you know with dominant probability that this is going to be your outcome. The other is where doctors, in essence, would advise you against fasting because of your medical condition. And inshallah, we'll talk a bit about this in a lot more detail. But if you're certain conditions like diabetes, you have certain conditions like kidney problems, or you may have heart disease. And in those instances, there are certain sets of criteria required that if you fulfill, then in those instances, you would be exempt from fasting. So this also includes, so these are the kind of things that you need to take into consideration: the physical and mental harm to self, also significant risk of losing the job or earning if you were in that situation. So for example, doctors who are doing surgical procedures, and clearly there is no way out, Ideally, they should plan their Ramadan such that they don't have long surgical lists. But let's say, for example, you know, they are putting themselves at risk in their job by through negligence because they're not thinking straight, or for medical legal reasons. For that reasons, they would, in those instances, and they would probably need to discuss with their local mufti about whether they would be exempt. But risk of harm to patient would be another reason in that situation. So inshallah, hopefully we'll get plenty of opportunity to talk about this particular aspect of it as well. But in these instances, the weakness due to fasting must be a real cause and a real risk leading to these issues. Okay, so it can't be just something which is just speculative. It has to be quite real, and you recognize that this is going to be quite a problem. So here you're expected to at least fast, and then can only break the fast when you feel weak or when there is a risk. The intention is essential, so you're deliberately choosing to work during fasting hours so as to have excuse this is not acceptable. So clearly you should plan your Ramadan well. And also in those instances, if that is the case, then you would make up for your fast through qada at an alternative time. So this is a useful slide because it really does emphasize a couple of really important things, and that is that we're all individuals, and you realize that different individuals behave differently and they react differently to Ramadan. So we recognize that when we look at people, we should look at people in terms of the decision of the individual, the religious practice of the individual, and the medical opinion. So the decision of the individual is everybody has their own understanding about what, you know, whether they feel unwell or they're feeling up to it. So recognizing that everybody has their own understanding and their own threshold about fasting, we have to sort of look at that from that perspective. The other thing is religious practice. Some people are quite religious, and they are much more strict in terms of ensuring that they don't miss their fast, whereas others are not so much as strict, and for that reason they are probably more likely to negotiate more in terms of the stringency of fasting. And finally, medical opinion. So there are differences that exist sometimes amongst physicians and doctors in advising people, and this is another issue that we're going to be highlighting, and how we should be dealing with that in terms of medical opinion. We talk also about that the books of fiqh talk about tabib hadiq, a Muslim doctor advising you who is experienced in this particular area. But reality is that that's not always the case in today's time. So for that reason, that any kind of reliable advice would suffice in this instance. Moving on, I'm just going to finally finish on invalidators of fasting, just to give you a bit of an outline about our discussions today, so that you have a good sort of rounded view before we actually go into the detail. So we also talk about invalidators of fasting. Now, invalidators of fasting, there's a couple of terminologies that you need to be familiar with, and a couple of ideas that you need to sort of understand. And let me just put this sort of visual to you so that it makes it a bit easy for you to understand. But when we look at things that invalidate our fast, usually we talk about these 5 sort of concepts. Okay, so we talk about, for example, number 1, the qualified agent. So actually, before I go into that, let's make it a bit easier to understand. So there has to be a qualified cavity. Okay, so in other words, what we call a jawf al-mu'tabar, there has to be a qualified cavity. So if, for example, food or water or even something which is not necessarily edible actually reaches a qualified cavity, like for example your stomach, then that would invalidate the fast. So that is one condition, that it must reach a qualified cavity. The other thing is that it must reach the qualified cavity through a qualified passage or an opening, which we call a manfas al-mu'tabar. Okay, so in this case, for example, a qualified opening or a passage would be your mouth, which leads through your throat into your stomach. So that would be a qualified passage leading into a qualified cavity, and hence your fast would invalidate. The third is that it has to be a qualified agent. Okay, so in other words, the substance that you are ingesting or taking in has to be one which qualifies, al-wasil. So in this sense, for example, it is food, or it's something which it may not be edible, but yet it's an object, but that would still, if it reaches the qualified cavity, would still invalidate the fast. So on the basis of that, what things qualify as agents? The other thing is al-wusul. So this is about the processes of how it does this. So in this sense, for example, in the Hanafi school of thought, the idea is that if the object disappears from view, so let's say, for example, you are placing something through the back passage, the anal area, like a suppository, then it would have to disappear from view for it to qualify as something that invalidates your fast. So there are certain processes that we need to take into consideration when we're making those decisions. And finally, absolving states. So there are certain states that would absolve you from actually invalidating your fast. So for example, if you forgot, so out of forgetfulness, so you came down one day and you had something to eat, and you then realize, oh, I'm fasting, I could forget. So these are absolving states. These are mawani' or the mani' that prevents, which basically gives you a reason that your fast has not invalidated. Okay, so inshallah we'll get a chance to talk about this in detail as well. So this gives a bit more detail what are qualified cavities. So the stomach, the throat, past the what we call the pharynx. We'll talk a bit about that later on, and also the intestine. So stomach to right up to the upper end of the rectum. These all areas. So anything that enters these areas would be a kind of qualified cavity. Qualified passage would be any kind of opening or orifice on the surface of the body. So be it natural, so either congenital or introduced, and it communicates with a qualified cavity. So it has to communicate with a qualified cavity, and it has to be a passage from the surface of the body. Then that would qualify. So even if it's the mouth, the nose, the ear canals only if the eardrum is perforated and there clearly is a hole there, and things can pass from there into the throat, then on those bases. So a rectum, a wound that penetrates to the stomach and punctures it into the stomach, even that would qualify as something that invalidates. So the following are not considered a qualified passage in light of hadith, for example. So for example, the ducts of the eye, so the lacrimal duct of the eye, or pores of the skin. So if you place cream on your skin, that would not be considered as a qualified passage. Or even injection, giving yourself a muscular injection would not be considered as a qualified passage. Okay, then we have qualified agent. So what kind of things are qualified agents? So agents that, for example, rejuvenate the body. They can be in food or medication, or do not rejuvenate the body. They would also be considered as qualified agents. So agents that are edible or non-edible will still be qualified agents. Agents that are liquid or solid, agents that are soluble or insoluble, so air, which is natural, sensations or extremes of temperature, hot and cold, these kind of things do not invalidate the fast. They're not considered as qualified agents. So we'll get a chance to talk a bit about that, inshallah, shortly as well. And then finally, qualified processes. So according to Hanafi school, for example, the following conditions for nullify the fast: entering the qualified cavity, the agent should disappear from view. I talked about this earlier on. So that would also be a reason. And there are states which absorb a qualified nature. So for example, if you're forgetfulness, and if there is arduousness, hardship. So for example, there's a lot of fumes everywhere and you can't escape it. So out of hardship and mushakka, then on that basis, then that would not necessarily invalidate your fast. And there are times, for example, necessity, out of necessity, or ignorance, or accidentally, or coercion, or sleep, that you were to consume in those states, then that would invalidate the fast. Okay, now that's quite a lot to take in. I recognize this. So these are the things that you need to sort of recognize that are qualifiers that would then therefore invalidate the fast. So there's quite a lot to take in there. So what we will do, inshallah, we're going to sort of explore these areas in quite a lot of detail with some of the speakers that we have, inshallah, today. So having said that, and then we'll get the chance to actually also listen to your questions and or any other things that you'd like to ask. So right, okay, now having done that, let me just get rid of these slides. Now, so let me just invite our special guest today. So, Alhamdulillah, we have Mufti Abdullah Nana. So, Mufti Abdullah Nana, if you put on your camera so we can see you, inshallah. So, we wait for that. So, here we have Dr. Shafi Malik. So, Dr. Shafi Malik, who is a consultant nephrologist, is that right? A consultant nephrologist.
That's right. Assalamu alaikum. Yes.
Okay. At the University Hospitals of Coventry. MashaAllah. So we'll just go into quite a bit of detail about some of the things related to some of the work that you've been doing. And then we'll go into we'll allow sort of people to ask a couple of questions. But you've worked with a team with the British Islamic Medical Association in formulating quite an extensive document on Ramadan Rapid Review. And this highlights a number of medical conditions. So like I was talking earlier on about medical opinion is quite important for us to qualify individuals for being exempt from fasting. And also recognizing the element of safety here. Can you just give us a bit of an idea about what this is all about, this work that you all undertaken?
Sure. So, first of all, Assalamu alaikum wa rahmatullahi wa barakatuh and Bismillahirrahmanirrahim. Thank you and Jazakallah for the invitation, Sheikh. So, as you mentioned, I, along with colleagues from different hospitals in the UK, we've been working together with the British Islamic Medical Association to formulate some guidance to assist patients and healthcare professionals to come to a shared decision-making model about safety of fasting and also explore some alternatives which you've already explained. So this actually started last year during the initial wave of the pandemic, and then we've since updated our guidance based on current literature. So it's actually based on the IDFDAR, which is the International Diabetes Federation, and Diabetes and Ramadan Alliance. So they've got a three-tier system, which is very well recognized and widely used risk system. So it's based on the risk of harm for patients who intend to fast. So there are three categories. There's a low risk category, low or moderate risk, and the second would be a traffic light system. It's a high risk category, and then the third would be a very high risk category. And what we tell patients is that in the very high risk category, that they must not fast, and in the high risk, they should not fast. And the low and moderate risk, they may fast but seek a clinical opinion from their healthcare professionals, depending on their condition. They may be under a rheumatologist, or if it's a kidney problem, they may seek opinion from a nephrologist such as myself, or a diabetes physician. So we've actually developed guidelines for all chronic diseases, not just chronic diseases, even occupational health. We've developed guidance because we realize there'll be brothers and sisters in different parts of the country and the world having to work during the COVID pandemic, wearing personal protective equipment, different working atmosphere, hardships, and so forth. So we've even developed some guidance for such brothers and sisters working in the healthcare industry. So we've got guidance for gastrointestinal symptoms, cardiovascular, similarly for respiratory, immunology, chronic kidney disease, solid organ transplant recipients. So it's all available online and published as well in peer-reviewed journals. The process was we set up like-minded Muslim physicians and surgeons, and we did a literature review based on current available evidence, and then based on expert consensus, along with in certain instances we've had to involve Sheikh Rashid yourself for your Islamic perspective on this guidance. And based on the expert consensus, we've then arrived at this three-tier system. So that's in brief.
Dr. Shafi, tell me, is this guidance specifically for clinicians, or is this something that patients can actually understand?
No, absolutely. It's written in very simple language. The idea is that we want it to be a shared decision-making model.
Right.
So we don't really want it to be prescriptive. We want physicians and surgeons to explore prior to Ramadan the spiritual and the motivation of patients and their intention to fast. And if they, if based on their motivation and their intention to fast, we then want patients and physicians together to come to a conclusion and to put into place a plan as to how they can achieve their goal and their spiritual goal of fasting during Ramadan. So, for example, we have patients who are in the high risk category. For example, they may have had a transplant in the last 1 year, or they may have very severe diabetes, or they've got chronic kidney disease on dialysis. And despite our advice, patients may still intend to fast. And our role as a physician is to try and make it safe as possible to fast. So we would put in place monitoring mechanisms during the fasting period to measure their blood test before, a week after, and then subsequently towards the end of Ramadan, and also give them advice on what to eat, what not to eat, how to manage their potassium and other electrolytes and fluid management and so forth. So our role as healthcare professionals is to work with patients to explore their motivation, their spiritual needs and goals, and inshallah try to put in place a mechanism to assist them to fast as safe as possible if they still intend to fast despite our advice.
So inshallah, we'll have the opportunity to talk a lot more in detail about this and in terms of where we can find this information. So let me move on to our other special guest. We have Mufti Abdullah Nana, who many of you should be familiar with. He has been on many of our other webinars as well, and he's also an instructor in some of our courses. So Mufti Abdullah Nana is quite a special person in America, who is the co-founder of the American Fiqh Academy, which is doing some excellent bits of research on contemporary masail and questions and queries from the Muslim public. So Mufti Abdullah Nana, are you there?
Assalamu alaikum, Maulana sir.
Wa alaikum salam wa rahmatullah. So just a kind of a question that I think would be really useful for us to understand. This is usually quite a challenging time for many of our ulama, because we got a lot of people from the public asking a number of different questions regarding fasting. Are we getting quite a lot of questions? And what kind of questions are you getting?
Yes. Bismillahirrahmanirrahim. I affectionately refer to the month of Ramadan for ulama and scholars in particular as overtime, where everything's in overdrive. So if the regular alim is getting maybe 5 to 10 questions a day outside of Ramadan, in Ramadan it will go up to maybe double the amount of queries and questions. And likewise, all hours of the day. Tarawih time, literally you're sitting at Tarawih time, you're getting phone calls. Mufti Sahab, in Tarawih this happened, can we repeat the salat or not? And also worth noting, perhaps this is, I don't have a proper study on this, but many of the scholars in America are saying, especially due to the pandemic and due to what's been going on in the world during the last year or so, the number of questions on mental health have been increasing. Or maybe there's something worth noting, kind of, I'm having problems in my marriage, I'm having problems with my family. So the frequency of such questions has also been increasing.
Right.
Also, there should be a warning signal, or should be something of concern to our community members, also our Muslim professionals in the medical field and also in the mental health field.
Okay, inshallah. That's very useful to know. And I can collaborate on that as well. During my Ramadan, is very busy with a number of different questions that are always posed, mainly in relation to medical issues, but also the fiqh behind them. So clearly, there are some very complex questions, and we recognize them. And sometimes it can be quite challenging, because sometimes the people who are inquiring, they don't always give detail and clarity in terms of some of those questions. Going back to Dr. Shafi and this sort of rapid review in Ramadan in terms of this sort of RAG scaling, red, amber, green scaling of high, medium, sort of low risk patients that you've devised. You mentioned that you've involved Muslim scholars, you've involved a number of physicians from a number of different specialities who have clearly a lot of expertise in this area. Now, and I've been involved in this as well, so I can sort of testify to that. How difficult was this? I mean, clearly because we recognize that even the evidence sometimes cannot be clear out there. So we're looking at evidence-based medicine. Sometimes that cannot really give us a real sort of detailed clarity in terms of, yes, this is the serious level of risk. So are we looking at a situation where, like you mentioned before, you use the word guideline, so which suggests that this is not incumbent upon you now, it's just something that would guide you? Is this something that you would verify and you would say that there is strong evidence for this, or do you feel that it's the best that you could perform and it should be something which is satisfactory?
Yes, no, I think it's a very good question. I can say it wasn't easy, and it wasn't easy mainly because, as you've already suggested, the lack of evidence. So the studies, certainly in my area, at least in diabetes and kidney disease, we did manage to find some studies. But if you look at cardiovascular science or rheumatology or gastroenterology or neurology, a very, very limited number of studies. And the majority of the literature actually comes from North Africa or from the Middle East countries, where, as you know, the fasting duration is usually around 12, 14 hours. And also the lifestyle, the work duration is much, much shorter than what we experience in temperate regions. So the studies have all come from the Middle East, and it's very difficult to generalize the findings of those studies to temperate climates or to the West. And I think that there's generally a lack of literature. So we did find studies that have been published in small systematic reviews and meta-analysis in kidney disease. And for example, in transplantation, there's only one study looking at liver transplants, none in heart or pancreas transplants or lung transplants, for example, although we do hundreds of such transplants. So there's generally a lack of literature and good quality evidence. But based on what we've had to come to an expert consensus among the specialists involved in treating Muslim patients.
So Mufti Abdullah, in terms of, so what we've had here is we have a number of expert physicians who have a clear in-depth understanding of their own specialities. So we've got cardiologists, we've got kidney specialists, we've got specialists in many different areas of diabetes, etc. And they've come together, sat down with some ulama, and they've sort of drawn up this scaling in terms of high risk, medium risk, and low risk. Now, something like that, is that something that we could potentially use that you would feel that even ulama could benefit from? Or do you find that it's something that you would have to solely just go by individuals? So it's a guide and nothing more. What are your thoughts regarding drawing up something like this? How beneficial do you think it would be for ulama?
So, mashallah, I think it's an excellent initiative, and perhaps looking at it from the fiqh point of view, it's very interesting that throughout the centuries, the classical scholars of fiqh have recognized the need for, as you mentioned earlier as well, tabib hadiq, recognizing the kulli fannin rijal, experts are required for every field. And as the scholars of fiqh have given us general guidelines, as you also alluded to in your presentation, will fasting cause a form of harm to the person? The scholars of fiqh have left it very general. Now, to interpret that and to apply that to specific situations, the scholars of fiqh recognize they are not doctors. That is not their field of expertise. And they have asked Muslims to refer to specialists in the medical field, consult with them, and to determine in their specific case, will fasting prolong their sickness, cause extra pain, cause them extra harm if they were to fast. So I think that I really would commend Balagh Academy and yourself and the Dr. Malik, who is also present on this program, for initiating this discussion and hopefully coming up with more solutions for the Muslim community, and also coming up with more guidelines and situations and rulings for various people who are fasting.
Okay, Jazakallah. Musab, I'm going to ask you another question in a short while, but before I do that, I just point out that we'd like our participants to come online, even inshallah, and ask your questions. So we have, alhamdulillah, a very experienced panel here. So if you have any particular questions, please do come online. You can use Q&A, and I will be making reference to the questions that have been put to Q&A in a short while. So please do come online and ask your questions. If you raise your hand, inshallah, we'll give you the opportunity to pose your questions. So Mufti Abdullah, there are certain times, aren't there, where, let's say, for example, the doctors tell us that this is a very high risk patient. So, you're somebody who's got, let's say, kidney disease and very end stage kidney disease, and the patient's insisting that they want to fast. At what point as ulama can we say that it becomes obligatory on you not to fast? Now, this is a quite important question, because I sometimes see this being used quite loosely. So I've even seen Muslim physicians even turn around to patients and say, look, it's haram on you to fast. What are your thoughts regarding that?
So that's an excellent question. It seems that the fuqaha of the whole do look at individual circumstances. And there are individuals who, at their current state, or looking at their state in the next few months or so, it looks like they will never be able to fast. Right? Looking at their medical situation. Now, perhaps the scholars did leave up that situation, maybe miraculous recovery, or maybe there's a chance somehow or another something will happen. There's a new medical breakthrough, and next year that person is healthy again. They're in a situation to fast. But as we know, generally, once a person is in that type of situation, at least for the next few days or so, we'll have an idea that person will not be able to fast. Now, I think the point that you seem to be alluding to is, with certain individuals, the only way they will listen to the ulama, or the only way they will listen culturally, is if you tell them it's haram to fast. And now it makes it very difficult, because we've explained everything else to them. It's harmful to fast. Perhaps you shouldn't be fasting. It's dangerous to your health. And the super Sufi approach, and this will not listen. So perhaps there does seem, Dr. Faqat, there does seem to be some scope to do so, in the fact that la darara wa la dirar, and the fact that fasting is harmful for that person. Yeah. So some people, in fact, use the term harm and haram, kind of the link between the two. And there seems to be a basis that if we know fasting will, for a fact, based on expert doctors like yourself, fasting will harm that person, and the person is not listening to us, there seems to be some scope for us to tell them, in your specific situation, because if you were to fast, it would exacerbate your condition, it would lead to XYZ situations. In your situation, it would be haram for you to fast. So there does seem to be some scope to do so. I would hope we wouldn't end up in such a situation where we have to tell this person it's haram for you to fast.
And I assume when we say that, using the concept of it would be haram for you to fast, it would be in a situation where we are quite certain that that person, if they were to fast, that they would actually cause serious harm to themselves, i.e. loss of life or loss of limb, etc. So it would require us to have some level of certainty. Okay, I'm gonna open up to some of the questions, and I'll sort of put the first question to myself, since I was the one who's mentioned this. So Ramiz Qudsi, he's put this question to us: are these 4 criteria, 4 principles criteria, and threshold that have been mentioned in the presentation I did earlier on, do they apply? Are they the same whether you are deciding not to begin to fast or whether to break a fast already begun? And the response to that is in both instances. So, for example, if you have experience of having fasted and you know that this is what would end up happening, you would fall in one of those 4 principal criteria to the degree that you're quite heavily burdened, you're unable to do your daily chores as a result of this, then that would be sufficient enough due to your experience that you would not need to fast that particular day, if that was the circumstance. And clearly, the other instances, if you don't have that experience, if you don't have that level of certainty about whether it would harm you in this particular way, then the expectation is that you fast. And when you fast, then you just measure up. And if you find that your state is vulnerable and you actually start experiencing these kind of symptoms, then that would be an indication that you can now break your fast and then make up for the fast later. And we'll talk a bit about the way you compensate for that in a short while. We've got Asthma 𝐀𝐚𝐥𝐚𝐿. Apologize if I'm not saying your name properly, but you're a student and currently doing online classes due to pandemic. So I want to know if I can observe i'tikaf at home in my room. I will do my classes online. Please note that I am a Muslim girl. Jazakallah. I think the question is not directly related to the medical fiqh question. So inshallah, we'll come back to that if we get time. Can we undertake, so the other one is, can we undertake pre-scheduled blood test? I'm not really sure what that question is relating to. I don't know whether the other panelists know what Mufaddal is trying to say there. Maybe you need to elaborate a bit more. Maybe you can come online and tell us a bit more. Yeah. We've got a Safwan about IV fluids breaking the fast. Now, this is a very controversial sort of question. And you'll find that many people have many different questions related, responses to this. I will let Mufti Abdullah Nana answer this question first, and then inshallah, I'll see if I can elaborate on a response on that as well, inshallah.
Dr. Rafaqat, if you could repeat the question.
So the question is, this is intravenous fluid, so giving yourself, let's say, glucose drips. Would that invalidate the fast?
So from a technical point of view, the scholars have discussed what is considered to be a jawf al-mu'tabar, as you mentioned in your presentation as well. So the muftis have stated the blood administering medicine through IV technically is not considered to be a jawf al-mu'tabar, although it will benefit the body, although it will bring fluids and medical benefit to the body. Technically, that is not considered to be a jawf al-mu'tabar, and therefore the muftis have stated technically it will not break the fast.
Okay, so just to elaborate on that, there is a difference of opinion related to that. And Mufti Abdul Nana is quite right in saying that quite a lot of muftis do stipulate that particular ruling. I've done quite an extensive article on that. So what I would do is I'd make, if those of you are interested in knowing the alternate view, then I suggest you read that and then talk to the appropriate muftis around who you trust and get their verdict on that issue. So we've got another important set of questions related to COVID. So for example, we got vaccines. So intramuscular vaccines. So these are vaccines that basically you inject into the muscle layer just beneath the skin. Does that invalidate the fast? Again, that's something that doesn't go through what we call manfaz al-mu'tabar. So the passage itself does not qualify. It doesn't go directly to the qualified cavity. For that reason, they would not invalidate your fast. So vaccinations do not invalidate your fast. So in that sense, it's interesting, Mufti Saab, it's worthwhile asking yourself about this, because now there's a discussion regarding COVID vaccines, recognizing, okay, right, fair enough, they don't actually invalidate the fast, but some people can feel quite unwell after them, can't they? They can start getting a bit feverish, and feel a bit unwell. So there are certain ulama who are actually recommending that patients don't have the COVID vaccine during Ramadan. Do you have a view on that?
So سقطت على خبير, as we say in Arabic, Dr. Faqat. Alhamdulillah, I had my vaccine done this past Wednesday. Myself, along with my wife, and along with my 18-year-old. So I guess there's a few different ways of looking at it. Number one is it seems people in the West are in a hurry to get vaccinated. And of course, as we know, the governments have also been strongly encouraging people to get vaccinated. So the challenge has been scheduled. If you get the first dose done, there is a limited window which you have to get the second dose. And because many people got their first dose done in March, now the second dose they had to do in Ramadan. So I guess in an ideal world we could schedule things more better. In America, I think what happened was people got whatever they could get, they got. Right, whatever was available, they got. I remember my relatives telling me, I'm looking at the online scheduling website and there's nothing available. And whatever appointment I could find, as soon as the appointment opened up, I got. So I guess that was a perspective from many people who chose to do so. And your point, Dr. Sapp, your point about the side effects of taking the vaccine and the effects on one's health, I personally observed it in my family myself. My family, my wife did get extremely sick. She ended up not keeping the fast. My son got extremely sick as well. He had to leave Taraweeh, which was another challenge. He ended up fast. Alhamdulillah, I was fine. I felt a little bit sore, but other than that, alhamdulillah, no side effects. So the challenge is, it's hard to gauge what will happen to a person. And as you pointed out, Dr. Sapp, I would advise on the following day, after taking the vaccine, I would advise on the following day, perhaps a person should not keep their intention, or maybe wait till noon. As we say, Dahwat al-Kubra, kind of adopt a wait and see approach. If your health is pretty bad and you think it might get worse, or you don't think you can do it, wait till about midday, and then decide whether you want to keep that fast or not. But especially as you pointed out, it's a person should pay close attention to their health for at least 1 or 2 days after taking the vaccine.
Yeah. So with vaccines, it is a quite common side effect that you can get temperature, you can get a localized pain around the area where you've been vaccinated. And people can sometimes feel quite unwell. So, to the degree that, they feel that they're not up to, going to work even. So I've had instances like that. And that's the reality of it. However, there are some serious risks in terms of those individuals who are not getting vaccinated, or they're postponing their vaccination. So Ramadan is, a whole month. So especially I would recommend those of you who have quite underlying conditions, and you would clearly fit into a category of people who should really be having their vaccination. Then in those instances, I would highly recommend that those individuals do get vaccinated regardless of Ramadan. And if they felt very unwell, having vaccinated themselves, then that would be a reason for them to break their fast if that was the condition, that was a state, and then they can make up for that fast later. But generally speaking, it's something which is speculative to sort of suggest that you should not take a vaccine just solely because of that reason. We got Wafiqa Albani, so who wants to come online and ask their question or whatever. So do you want to come on? Yeah.
Yes, please. This is probably very new. Thank you so much for this wonderful presentation. It's very great. We all need it. I'm talking about the use of essential oil.
Just before you carry on, Wafiqa, where are you from?
Virginia, US.
MashaAllah. Okay.
Yeah. Thank you. Originally from Syria, if you're wondering about my accent.
MashaAllah.
Okay, so I use the essential oil, whether on the skin, or in the diffuser for instead of medicine and all these kind of things. And I understand what you said, but I'm trying just to confirm when we're fasting. Let's say I have a migraine and I apply it to the back of my neck. Would that break my fast? Or the bottom of the feet or the wrist? So it's on the skin, nothing going through the mouth.
Okay, so anything that's been applied to the skin, in essence, would not invalidate the fast, because the skin, the pores of the skin, clearly, which is what they will permeate through, the chemicals, would not actually invalidate the fast. They're not qualified apertures or qualified passages. So for that reason, it would not invalidate your fast if you are applying it to your skin.
Thank you so much.
Okay,
Jazakallahu khairan.
no problem, inshallah. So anybody else? I think we had somebody else, but they put their hand down. We'll come back to that because we've got quite a lot of questions here anyway. Okay. So the question relates to using insulin injections before breaking fast. So does this invalidate the fast? Now, I remember being on an ulama's group, and there were one or two individuals on there that actually said, well, I don't know about that because they, and the ulama group that I'm actually on is, they've got sort of immensely varied opinions, different schools of thought and various other sort of different followings. So it's quite interesting sometimes to hear the other people's views. So there were one or two individuals who were there saying that, but I don't know, it's a bit, you know, the fact that you're actually putting insulin into your bloodstream. But reality is, majority of the scholars do say that insulin injections do not invalidate your fast, because again, it goes into the subcutaneous tissue under the skin, and that would not really be considered as a qualified passage to invalidate your fast. Okay, now we've got questions related for Dr. Shafi. So we have Tahira Wellman, who's asking the question, just elaborate further on the list of what criteria were used for risk stratification. Did you have a criteria that you used for risk stratification for some of those different disease conditions?
Sorry, yes. Thank you for your question, sister. We use the IDF-DAR, which is the International Diabetes Federation Diabetes and Ramadan Alliance suggested criteria. It's a very well-established criteria which has been approved by the Mufti of Egypt, the International Fiqh Academy, and Organization of Muslim Sciences. They first published their guidance just for diabetes patients in 2016, and it's been used by the American Diabetes Association and Canadian guidelines and so forth, similar methodology. And we use the same risks tier system, the traffic light red, amber, and green system, to risk stratify patients with chronic diseases, and it's quite detailed. So to answer your question, we use the idea of that, which is very well established. It's based on the risk of harm that the patient might experience if they were to fast with a certain condition.
Okay, Jazakallah. And we've got a question from Mufaddal, and I did go back to your question, and so I will elaborate on your question here. So this is about giving blood for blood tests during pregnancy whilst fasting. Does it invalidate the fast? If so, can we do qada later? Now, when you're actually, it's an interesting question, and I'll get Mufti Saab to come into this as well. So actually, taking blood from you does not invalidate your fast, because you're not actually taking something into your system. However, the question here then arises about maybe people who are donating blood. Mufti Saab, what's your thoughts regarding that? If somebody's asking you, I'd like to donate blood, and I've got an opportunity to do it now during Ramadan, I recognize it doesn't invalidate my fast, but can I do it? What kind of advice would you give there?
The legal precedent from Islamic law seems to be the discussion on cupping. Like in the classic books mention Aftar al-Hajm al-Mahdum. And there is a discussion among the classical scholars with regards to cupping. Here we're referring to wet cupping while a person's fasting. And it seems that the thought process is that generally when someone loses a large amount of blood from their body, they will experience some form of weakness. And this could potentially make it very difficult for them to fast or cause weakness as well. So it seems on that basis as well, if a person does have a choice and they can schedule it, then schedule some blood donation after the month of Ramadan or outside the month of Ramadan. Of course, they can also consult with their doctor as well. We do have Dr. Malik and yourself on this panel. Looking at their age, looking at the amount of blood drawn or donated, looking at the season of the year, et cetera, how likely is that blood donation going to cause extreme weakness? Right? So perhaps on that basis, they can make a decision whether or not they wish to donate blood or not.
Okay, inshallah. Now this is another quite important and quite controversial question. Again, a lot of people sort of give a number of different perspectives to this question. I'm quite open to dealing with all sorts of questions today, inshallah. So we're all getting challenged. And recognizing there is diversity of opinions in many of these discourses. And what I want to do is, so the question is related to asthma and using inhalers. Okay, so this is a very sort of recurrent question that always sort of appears and it sort of causes debate. What I'm going to do first is refer to Dr. Shafi regarding what are the guidelines regarding this? What kind of guidelines have you produced related to asthma? You've done some work on this as well.
Yes, alhamdulillah, we've actually covered respiratory diseases. We have covered asthma. And the guidelines very clearly suggest that if it's well-controlled asthma, or if it's someone who's got chronic bronchitis or COPD, as it's called, chronic obstructive pulmonary disease, and if they're requiring inhalers, but if they've got stable disease, so well-controlled asthma or COPD, then they should be at low risk of having any harm from fasting. So they would be in the sort of green category. However, if they've got, if they're experiencing an acute exacerbation or worsening of their asthma during Ramadan or during fasting, or even prior to, if they've got a history of very poorly controlled asthma requiring hospital admissions or steroid treatment or number of inhalers, we would actually classify them as very high risk. And in between, we've also got amber category, where patients may be between stable to someone who's getting very frequent exacerbations. So they would be in the amber category. And for example, if they require nebulizers throughout the day, we would consider them as high risk compared to just requiring inhalers, where they would be low risk.
Okay, just to elaborate on this, there is a link that's been put on the chats to the compendium. So anybody who's interested in that, they can go onto that link. It's for a British Islamic Medical Association link. So please do use that, your link, or use it at your disposal. Just an additional question related to that, and that is preparing for Ramadan. Before we go into the detailed fiqh related to asthma inhalers, and I'm going to make reference to Mufti Abdullah Nana because they've done quite a bit of work around this in some of the fatwa that they've written related to this in a second. But preparing for asthma exacerbation or bronchitis exacerbations, the kind of advice that we normally do, even in general practice, is, we do sort of ask patients sometimes, especially those who are quite with it, to have a peak flow meter. That gives them a bit of an indication in terms of whether their asthma is gradually going to, it's a preventative thing, so whether the asthma is going to get worse or not. So they can actually then, work around that. So it may be that they might want to change their inhalers, maybe just before Ramadan, long-acting inhalers maybe, so that it doesn't invalidate the fast if they are using an inhaler. Which goes to the point about inhalers and whether they invalidate the fast. So Mufti Saab, from some of the work that you've done, what are your conclusions regarding using inhalers do they break the fast? I know there are certain opinions out there that they don't, but what kind of conclusions did you draw?
Yes, so the American Fiqh Academy, we researched this topic for roughly about, I'd say, 4 to 5 months. We consulted with a number of doctors as well. Our resolution is available online. If you look at the American Fiqh Academy website, using valved holding chambers while fasting. So our research paper is about 17 pages long. Also worth noting that the Indian Fiqh Academy also took on this topic around the year 2008. They published about a 400 to 500 page research paper on the topic, of course in the Urdu language, not in English, but a great deal of research has been done on the topic. Also, of course, we have different interpretations on what is considered to be a jawf or a valid orifice into the body as well. So we'll be based on the different madhabs. So as a disclaimer, you will find a difference of opinion among the scholars, even among the Indian Fiqh Academy. You'll find a difference of opinion. So I guess one of the main issues that we're looking at here is that you have regular asthma inhalers, which, for example, my mother has been using for many years. Now, in recent years, we have more advanced methods, which they refer to as spacers. That's kind of the common term. And the difference is spacers are more effective in delivering the medicine to the lungs. Whereas a normal asthma inhaler, people misuse the asthma inhalers. Sometimes the medicine doesn't end up going down properly, or they don't know how to use it properly. So the main benefit with the spacers now, you have a more efficient system of delivering the medicine to the required area, which is the lungs. Now, what is worth noting is, even with the most effective spacers and the asthma inhalers, because on the way to the lungs, you have to go through the throat, it is an established fact that a small percentage of that medicine will go down the throat, right? And in fact, they've measured it as well, looking at the medicine in the asthma inhaler in the first place, looking at the efficiency of it. It's a very small percentage. And I guess this is where the debate starts. The percentage you can estimate is about 0.1 milligrams or milliliters, right? So less than a drop. I mean, we're talking about a percentage of a drop. But at the same time, it is a known fact this amount is going down. Right? It is going down as trace amounts. It's the particles remain in the mouth, and when the person swallows, they will go down the throat. So that's a starting point on this discussion. And one way of looking at it also is the percentage that goes down your throat. How does that compare to the amount of water left in your mouth after you gargle while making wudu while fasting? It's also kind of to put this in perspective. So there's a Muslim doctor who did this study. He took a small cup of water. While people were fasting, he had them put this water in their mouth, gargle, and spit it out, and do their best to completely remove that water from their mouth. So he found on average 1 to 1.5 milliliters of water were left in the mouth, despite the best efforts of the person to completely spit out the remaining water. This trace amounts were left in the mouth. And as we know, anyone who is fasting is going to perform at least 4 salats, 3 to 4 salats while they're fasting, and making gargling while making wudu is part of wudu. So this is and the scholars have also allowed a person to gargle while fasting as well. So this is where the discussion starts. Is this amount, which we know for established fact goes down a person's throat while fasting, is this significant or not? This is the real question. So to cut it short, the American Fiqh Academy gave the final ruling that using spacers or valve holding chambers while fasting will break the fast, right? Based on a number of factors, it will break the fast. And perhaps the closest legal precedent, maqis alayh, or the closest legal precedent, is also intentionally inhaling or smoking a cigarette or doing hookah while fasting. So you can say, at least in the Hanafi school of thought, across the board, if a person purposely burns incense and inhales it, or purposely takes a steam bath and inhales it, or if a person purposely puts hookah in his mouth and inhales it, that will break the fast. And according to many scholars, in fact, not only will it break the fast, because it's done intentionally, they'll have to do the kafara of 60 consecutive fasts as well. So that's a summary of our research. Yes, we do recognize that there is a difference of opinion, and we do recognize that some muftis and some madhabs and schools of thought will also differ in this regard.
Okay, so that's quite an extensive response. So alhamdulillah, hopefully that's addressed a lot of the questions, and these debates will continue. But yeah, I mean, I looked into this for quite considerable time, and this question was posed to me a number of times, and I swung from one opinion to the other. And then I sort of came to the very same conclusions. And a lot of the work that I've done on this is available as well. But so yeah, so there are two issues here. One is the intention, that you're actually intending for something to pass your throat, and clearly when you're intending for something to pass your throat, then it's inevitable that it's going to go into the gut and to the stomach, and just that in itself and the quantity itself would be good enough reasons to actually suggest that this would invalidate your fast, like Mufti Saab's explained in quite a bit of detail. I'm just going to carry on. I'm going to let somebody else come on. So we've got Siraj. You want to come on, inshallah.
Assalamu alaikum.
Wa alaikum assalam wa rahmatullah.
I've posted a message on the chat as well to yourselves. Apologies, I was out and my reception kept on dropping. So in case you've already answered, I do apologize. Basically, my mum's had her first dose of AstraZeneca vaccine, and her second one is due on the 4th of May. Now, I know Mufti Saab, I heard bits and bats kept on dropping off. I think he was talking about scheduling the vaccine. Now, we spoke to the surgery about delaying the vaccine until end of May, just in case.
I think we've lost you.
There's any side effects to the second question? Is it going to affect or impact the effectiveness? And they weren't sure, but the lady I spoke to wasn't medically trained. I think she's working in the office. So I just want to know if you have any opinions on that, please.
Yeah, so it's quite a combination of medical and fiqh. But generally speaking, the main idea here is that having a vaccine will not invalidate your fast. So it's not something that is prohibited. On that basis, you have that autonomy to have the vaccine. Now you need to make a decision in terms of harm and benefit, whether you feel that you should have the vaccine as soon as possible, and in that case having it during Ramadan, recognizing there is a small percentage of people who will have certain effects due to the vaccine, such as fever and so forth, that will actually prevent them from fasting. So taking that into consideration, you probably, if it's the second vaccine, then you'll have a better idea how that person was with the first vaccine. So you probably can go on the basis of that. If they sort of tolerated it quite well, then I don't see any reason why they can't have the second vaccine during Ramadan as well. We got another individual who's under the name of Galaxy Note 10 Plus. They have not mentioned their name, so we will allow you to come on, inshallah, if you have any questions. No? Okay, nobody. Can you? I'm not sure whether you're coming on or not. Okay, we'll ask some of these other questions, then we'll go back to you if there's a need. So we got Waqar Khan, who's asking, I get severe pain in the back of my neck from time to time. When the pain begins, it begins to intensify. The only way this improves is by taking painkillers and wrapping up and sitting still without moving for about an hour. Can fast be broken if this happens towards the beginning of the day? The pain is unbearable, but I cannot continue to walk around and do daily tasks. Now, the issue here is, it's an interesting question, because what we're talking about here is just solely pain management. And this is transient pain or intermittent pain. It's not pain which is constant. And now there are if you're suspicious that, or if you're in a situation where you know that you're probably going to get regular pain through the day, then I would highly recommend that you take long acting pain relief. So there are certain medications that you can take, modified release tablets for pain relief. So I would highly recommend that that's the kind of thing that you do. Or you can take pain relief gels or creams. So there are certain pain relief gels and creams that you can use them. But if it's to the degree where clearly it's impacting your daily chores, you're not able to commit to, like, you know, you're struggling even to walk. For example, somebody's got severe lower back pain, they can't even walk. They're struggling even doing the most basic of chores, and they have to have regular painkillers through the day. Then I would recommend that you discuss that with your local imam or mufti and get some clarification about your particular personal case. But overall, if it's causing that much, you know, severity, then in those instances, if there's no other option but you to but take regular painkillers by mouth through the day, then I suppose you would be exempt in that instance. We've got Dr. Baig who's asking, getting a blood transfusion breaks the fast. It goes back to the same question that we outlined earlier on about having a drip, IV drip. It's sort of same kind of ruling. If you're having a blood transfusion, some ulama do say that it would invalidate the fast. There are a few that say it doesn't. So that's something that you would have to discuss with your local mufti. There is a difference. If a patient is sick and has to get, again, intravenous antibiotics, same kind of question again. Anything intravenous, it's going through into the venous system, so it will be addressed in the same way. Okay, technical question regarding the presentation. Tahari's put down, what's the difference between Wassel and Rasool? Wassel is, in essence, referring to the agent. So, for example, we talked about inhalers. So, in other words, the content of the inhalers will be the Wassel. And the Rasool is the process itself of how it actually gets to the cavity or whatever. So, this is the process in terms of, for example, according to Hanafi school of thought, if it disappears from view, then that would be considered as something that's passed, and hence that would be something that would invalidate the fast. So for that reason, that just refers to the process. So we've got a question about reflux problems. So when I don't eat on time, it causes me a lot of pain. It feels like I'm getting a heart attack. My chest tightness is still possible for me to fast. Again, these are quite important questions, even though, you know, because they're very specific to individuals. So I suppose I can make reference to Dr. Shafi here. So we do have questions where people are explaining acute episodes of certain symptoms, like, for example, severe heartburn to the degree that they're not able to do certain things, and pain to that degree. Have you thought about maybe providing certain guidelines, maybe about pain management? Is there something about pain management mentioned in your guidelines at all?
So not specifically pain management as such. However, we recognize patients with different chronic conditions may experience pain. And for those conditions, they've been addressed. For example, if they've got ischemic heart disease or angina due to heart problems. So that has been addressed. And if they've got what we call stable angina, where they're on medicines and they don't experience any chest pain, they would be able to fast safely. However, I think the question, if I'm not wrong, is asking about indigestion and so forth. Yeah. And if they've got gastrointestinal disorders, then that can be treated beforehand, so they can start taking either some antacids or medicines such as omeprazole, which we commonly refer to as PPIs, which helps protect the stomach from the acid. And also we would recommend lifestyle modification, so avoiding spicy food and so forth during suhoor, and also having small meals after iftar to counteract some of those side effects.
Since you're on, Dr. Shafi, I've got a specific question for you related to a kidney transplant patient. So my wife just had, this is Waqas is asking this question, my wife just had a kidney transplant about 3 months ago. Her nephrologist suggests not to fast as it could make her delay the immunosuppressants will make her dehydrated if she doesn't drink water during the day. So doctor said that fasting will make her kidneys stressed out. So please advise, what kind of advice would you give somebody like that? What kind of things would you need to know more about maybe?
Sure. I think it's a very important question. So what we would normally advise is patients who've had a renal transplant or any other solid organ transplant, we would advise them against fasting for the first 1 year. The reason for this is because patients who've had a transplant obviously get the kidney or the solid organs from some other another individual, and our own body, when it's been given to them, their immune system needs to be trained to avoid rejecting it and to adjust to that new organ. So the patients usually have to take medicines with a very strict 12-hour break, because any difference in that 12-hour break would mean the medicine levels go up and down and lead to an unsteady level in the blood, which can then lead to rejection, which can obviously have far-reaching consequences. So for that reason, we would definitely recommend patients not to fast in the 1 year, because the chance of rejection is very high in the first 6 months, and also to get these immunosuppression levels correct, and also for the new organ to find a very stable baseline where it's happy in the environment, and the patient also recovers very quickly and well from the operation and surgery. So that would definitely be a recommendation. It is possible for transplant patients to fast in the longer term, but they would have to undergo certain medication changes beforehand to make some of these immunosuppression medicines once a day. There are medicines that can be taken just once a day instead of twice a day, but it has to be done much before Ramadan in sequential order. So one at a time, we would change one medicine, monitor the kidney or the heart for any rejection, and once we're happy, we would then make further changes. But it is possible in the longer run for transplant patients to fast without any difficulty, inshallah.
Okay, Jazakallah. Muhtasab, now I'm just going to repeatedly throw many controversial questions at you, but generally speaking, I think you're the ideal person to respond to them. So there is another thing, and I had this earlier on today. I had one or two people ask this question earlier on today, and that was in relation to, and somebody's just asked this question on the question and Q&A, and that's about people who don't have what we call tamyiz, you know, so they're not able to sort of have the ability to sort of comprehend the conditions of Ramadan, for example. Yeah. So these may be individuals, number one, who are either born that way, so they may have severe autism or learning disabilities or things along those lines, or it may also be individuals who have late age, you know, they're senile, they have Alzheimer's, they've got dementia, those kind of individuals. So you've noticed that I mentioned two groups of people there. There are those who are born this way, and there are those who have clearly ended up with a disease condition such as Alzheimer's, and they've ended up in this situation. What is the situation with the latter? So let's talk about the ones who've got, like, for example, dementia. When you are asked this question, how do you normally address it?
Yes. I think the starting point for that specific issue is who is considered to be mentally qualified to fast, and also who's in the right frame of mind, or considered what we refer to as mukallaf. Right? Mukallaf would mean those individuals who are in the right frame of mind, who are in their senses, and who Islam or who Allah subhanahu wa ta'ala is asking to fast. And of course, maybe the other way of looking at it is the extreme case, that we know that there are certain individuals who are not sane and who do not remember what they're doing, or who have who completely do not have any concept or idea of what they're doing. Right. So I guess the starting point is Islam does recognize that there are certain individuals who are responsible to carry out Allah subhanahu wa ta'ala's commands, who are the primary addressees of fasting, of performing salat, etc. And in simple terms, there's some individuals who are excused, who are not of the right, who are not sane, and so on. At the same time, I think there's a need for the research. So Dr. Saab, if you don't mind me turning the question right back on you, because there also seems to be this issue of people in between, what we ma'tu, right? Ma'tu is a term in fiqh. So people who are, and I personally know relatives or personally know individuals, half of the year they're fine, half of the year they're not. People who kind of flip, they maybe half the day they're fine, and maybe half the day they're not.
Yes.
So I think this program put on by Balagh Academy is excellent, because there's need for more collaboration.
Yes.
The scholars of fiqh will just look at it purely from who is who is sane and who is in the right frame of mind, whereas now we would need to consult with the medical experts and doctors and mental health experts to determine are these individuals or are they in a position to fast or not, or are they in the right frame of mind.
Okay, so so we recognize there's some serious complexity to these kind of instances. So patients who are clearly got severe dementia, and they are, they're in a permanent state. How do they compensate? So just elaborate on that for us, just very briefly.
So the argument would be if they were once, you had mentioned the second group, these are people who are senile or who at some point were able to fast, and now they're senile or they've just suffered dementia. So because at one point they were able to fast, now they're in the laws of fidya would apply to them. And the laws of fidya would apply to them, and their family members can now, on their behalf, if they have money which is available, use that money to give fidya on their behalf, and for every fast that they're not able to fulfill.
And that's quite important, because what you've just mentioned there regarding people, and I want to reiterate this point, because sometimes people don't really always understand this. So these are individuals who were able to fast before, and because of their illness now are unable to fast. So these individuals, and this is a permanent state, and then these kind of individuals could give fidya as form of compensation. Now let's go back to the other group, which is the ma'tu' that we made reference to. These are, so let me just elaborate about what that actually means. So it's a term that ulama use, and what that really makes reference to is those individuals who were born with learning disabilities. So they clearly were unable to sort of comprehend any kind of understanding of the rulings of fasting. So what would be the ruling related to those kind of individuals? What's that?
So it seems that the laws of fasting would not apply to them in the first place.
So they're not mukallaf. Yeah, so they're not. So they're not mukallaf. So in other words, these individuals would not need to pay fidya.
Yes, Dr. Saab, it's just coming to my mind right now, and I don't have my books in front of me as well. But what's your take on that second group, the group that at one point in time was healthy, later in their life they suffered dementia? If they're not mukallaf, would the laws even apply to them? So one is a person who is unable to fast, one is a person who's no longer mukallaf. So could we look into the concept of maybe fidya not applying to them, because they're no longer longer mukallaf at all?
Yeah, I mean, I usually sort of draw up the analogy in terms of a child, for example. So a child clearly is not mukallaf. So a child's ability, cognition is not to the degree that they could comprehend the rules of fasting. So they would, and they've always been like that, so up to that particular age. So they would in essence fall into that same sort of category. This was a discussion on our ulama's group actually just today. And it was sort of discussed amongst a number of ulama regarding that, and the ruling was that in these instances that these individuals would not need to pay a fidya because clearly they've got serious learning disabilities. Dr. Shafi, do you have anything in guidelines in terms of mental illness, for example? This is something that Mufti Abdullah has made mention on. It really is quite complex, sort of drawing up, because we recognize a mental illness, somebody who can be quite well throughout the whole fasting period of the day, and then at night time they begin hallucinating, and they are not, they're not up to, up to that sort of, they got sort of psychotic. So do we have any guidelines on that? Is it so complicated that we can't really draw clear guidelines on this?
No, alhamdulillah, we actually do have some guidance for mental health. And again, if it's mild mental health illness which doesn't affect their functioning, or if it's well-controlled mental illness which we've described as no relapse in the previous 12 months, and with the previous history of safe fasting, they would be categorized as the low risk category. And in the higher risk category, we've got stable bipolar or psychosis, but they've had to have no relapse within the last 6 months, and that they are compliant with their medicines and they're stable on their medicines, and their psychiatrist or physician considers them to have stable mental health illness. And any of the other patients with poorly controlled serious disorders, or requiring frequent medicines more than twice a day, for example, would be considered as very high risk for harm.
Okay, inshallah. Now, unfortunately, we are running out of time. Inshallah, what I'm going to do is I'm just going to give an opportunity to one person to come online and ask a question. And then what I will do is I will just randomly pick a question from the Q&A, and inshallah we'll answer that. But before, we do have a separate session on Balagh Academy on Invalidators of Fasting. For those of you who I would highly recommend that you join onto those courses. So there are a number of ulama who will be delivering the courses on the fiqh of Ramadan. So inshallah, you'll have the opportunity to talk to ulama specifically related to some of those questions. And also I will mention a bit later on something that Balagh has been doing, a little project that we've sort of put forward, which is very unique, that will assist a lot of people in addressing some of these very straightforward questions, which I will put on post now, hopefully, inshallah. Just 1 second, if I can. Well, I'll post this just on the chat, a link to the Fiqh of Medicine. It's a search facility that you can actually just put in your question in terms of, like, for example, smoking, and then it'll tell you whether it invalidates the fast or not, and so that it sort of answers your quick response. However, I do recommend that you need to talk to your local imam. It's a bit more complicated. So, right, let's go to people who want to ask a question. I really do like to get questions from people who want to come online. Will our sister Roya? Are you there?
السلام عليكم دكتور.
وعليكم السلام ورحمة الله.
جزاكم الله خيرا. أنا ابني عنده تيومر في الغدة الدرقية pituitary gland. فهل الدكتور طبعا منع رمضان ده إنه يصوم، والتيومر ده has been for 10 years and we just discovered it this month، يعني because of fainting على طول كده. يعني is it possible إن شاء الله if he يعني إن شاء الله he won't يعني doctor didn't mention no any surgery or anything, but if he manages with the medication and هو it becomes much better, can he إن شاء الله fast next Ramadan or كده إن شاء الله or is it forever we cannot fast?
Yeah, it's quite a complex question in the sense that, okay, so basically somebody's been diagnosed with cancer, and sorry,
it's cancer. It's not cancer, just tumor.
A tumor. Okay, right. So it's not actually a malignant. Okay, so it's just a benign tumor. So, right. Okay, and where is this tumor? Sorry.
At the left back of his head, the upper left.
Okay. Dr. Shafi, do you have any guidelines regarding people who have been with regards to cancers? I mean, I'm supposing that you're talking about more. Your guidelines are more related to terminal cancers that are undergoing chemotherapy, maybe, or even treatment, surgical treatment. Do you have any guidelines on that?
Yes, so we've got
I'll
guidelines
address
on
the rest
solid
of it
tumors. Solid tumors, but not necessarily benign. So it's difficult to suggest or give an opinion without knowing the exact facts. But there is, as you said, receiving chemotherapy and so forth. We've got some guidance related to that.
Okay, so yeah, it really depends on the state of that particular patient. So if they are quite healthy in themselves, they don't have any other underlying conditions, and they're undergoing chemotherapy, then there's something that Dr. Shafi's mentioned in terms of guidelines related to those who are undergoing chemotherapy, radiotherapy, etc. So if you're undergoing treatment, then there are certain adverse effects that can occur because of the treatment that you're having. So you have to be a bit careful about, you need to get the advice from the clinician related to what kind of chemotherapy you're having, or whether it's advisable for you to fast, and we have guidelines that Dr. Shafi's mentioned regarding that. But if it's somebody, sorry?
Yeah, please go on. Sorry. Please go on.
Yeah, and if she's just somebody who's undergoing investigations, but she's quite healthy in herself, or then you know, if her state allows it, then I don't see any reason why she can't fast in that particular instance.
Can I just ask something? Can we avoid the chemotherapy and depends on medication? Because I don't feel well about this. And my son goes through chemotherapy because I have a friend, she suffered from this. Is it reliable?
I think because it's quite very specific questions related, you probably need to talk to somebody quite in particular. It's more specifically about her personal circumstances. So we're sort of dealing mainly with generic questions at the moment. But yeah, because I don't want to miss out on anything, that's quite important. So I think it's important that you discuss with somebody in relation to her personal situation. Okay, Jazakallah.
Can you please remember my son in your dua, Dr. Rafa?
Okay, no problem, inshallah. Jazakallah khair.
Remember him, his name is Safwan. Would you kindly remember him in your dua?
Inshallah, Allah gives shifa kamila, inshallah. Now we have a question. Okay, this is interesting. We got Razia who's asking the question, oh, one of my friend's daughter has donated her kidney to her son about 3 months ago. Can she fast? Dr. Shafi.
Yes, so a very interesting question. The reason we didn't include this in the guidance is because we would expect someone who comes to donate a kidney to be a healthy individual, because it's only when they're healthy they would actually be allowed to donate a kidney. And but however, if they've recovered well from their surgery, and if their surgeon or physician feels they've recovered well from the surgery and their blood tests are satisfactory and they're feeling well in themselves and back to their usual selves, then I don't see any reason why they wouldn't be able to observe fast during the Ramadan. But from a health perspective, we would expect them to be normal individuals without any underlying health conditions. And that's the reason they've been allowed to donate in the first place.
Okay, inshallah. Okay, right. So what we'll have to do is, unfortunately, we'll have to leave it there. There are a number of other questions, very important, useful questions, inshallah. But unfortunately, because of the time limitations, we'll have to finish at that point. Now, Balagh Academy has, like I said, mentioned, we produced an app that you can use. Unfortunately, for some reason, I can't seem to. Oh, there you go. I've sent it now. So if you look on your chat, you can see the Fiqh of Fasting Balagh Academy app. You can go into that. So this app, in essence, you can use, and it asks simple questions, basic questions. But if there's any complexity to your question, then you need to refer to your ulama and get more detailed responses. But generally speaking, you can use this app. And there is also some 2 documents of some intense research that I've undertaken that relate to the responses themselves. So it's useful for both the public generally and for ulama as well. So I'd highly recommend that you pass that on to other people who have a number of questions. So what I do now is I just send this app to many people, and it saves me the time to sort of focus on other things in addition to responding to people's questions. So I also would like to thank considerably our special guests, Dr. Shafi Malik. Thank you for coming on, and Allah reward you and send plenty of blessings for you and your family, inshallah, during this blessed month. I know you've been taking a lot of time out with the work that you've done with British Islamic Medical Association, as well as some of your other colleagues who have were unable to come on today. And I realize and appreciate that they've done, you know, Dr. Waqar and Dr. Nazim, you know, the amount of work that they've done, put the efforts they put in. Allah reward you immensely for, you know, the efforts that you put in this work, which will be of benefit to our communities. Jazakumullah khair. Mufti Abdullah Nana, again, thank you, you know, Jazakallah khair for your time. We realize how busy you are and the immense work that your Fiqh Academy is doing in relation to many, many different masal. These are just some of them. Allah subhanahu wa ta'ala reward you immensely and place a lot of barakah in your efforts in this month, yourself and your family. Jazakumullah khair for taking the time out for joining us, inshallah. And I'm sure we will see many times again, inshallah, you on some of our webinars and our courses, inshallah. Jazakallah khair. And thank you all for attending, and hopefully it's been useful. I apologize if we were not able to answer all your questions, recognizing that we could go on all day. So if you have any specific questions, I recommend that you talk to the ulama that you are acquainted with and get your responses from them. However, we do have courses on Fiqh of Academy. So the Invalidators of Fasting is one of the sessions that will be in our Fiqh of Ramadan course this Ramadan. So please do join our course if you would want to know more. And Jazakumullah for attending. May Allah subhanahu wa ta'ala bless your efforts and make your fast as a means to taqwa, and inshallah make it all easy upon all of us in this horrible time during COVID-19. Jazakumullah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.